Hi, my name is Greg Scott. I'm a Mazama climb leader, and I'm also a member of the Mazama CISM team. I'm here to talk to you about what's called Critical Incident Stress Management, or CISM. First off, I'd like to say congratulations. If you're watching this video, then you're almost done with BSEP. Be sure to thank your instructors. About 18 years ago, I sat where you're sitting now. You've got a lot of climbing ahead of you, just enough to get into trouble and possibly experience what's called a traumatic event. A traumatic event is also known as a critical incident and can cause what's called critical stress. 90% of adults are exposed to some sort of trauma. If you're wondering what it feels like, just think back to a time you had a near miss driving your car or riding your bike. Maybe you had to slam on your brakes to avoid an accident. Your heart probably started racing, your palms probably got sweaty, and you probably mentioned it to someone later. If this happened to you, then you experience critical stress, and it's a normal response to an abnormal event. Now, I don't want to sound negative, but I've personally known 2 people who've died climbing, another dozen who have been injured, and I've even been involved in an accident in the mountains involving a climb team member. As the famous poet Elvis Costello said, accidents will happen. But I'm not here to talk you out of climbing, quite the opposite. I'm here to introduce you to a resource the Mazamas offer if you are ever faced with a traumatic event. This is Critical Incident Stress Management. Safety is a vitally important aspect of all Mazama activities. Leaders receive training in on-site first aid and accident management. Accidents will occur despite our best efforts. It might not even be your group that has an accident, you just may be exposed to others. Typically in an accident, there's an immediate coordinated medical response, but often overlooked is how people are dealing mentally with a traumatic event or critical incident. The CISM team offers peer debriefing. This is an important means of speeding emotional recovery for team members experiencing normal responses to abnormal events. This technique was developed over decades by professional organizations, including police, firefighters, first responders, trauma units, and rescue organizations, as well as the military. Mazamas formed their CISM team after a 1993 incident on Mount Shuksan involving a climber who was trapped in a crevasse for hours. Since that time, our team has held over 60 debriefings. The team is an ad hoc committee of 12 members who receive specialized training as peer debriefers. Committee members include both Mazama members, some just out of BSEP, as well as mental health professionals. So what is a critical incident? It's something unexpected. Has a strong emotional impact. It overwhelms our usual coping abilities. It can trigger a major change in the way we think, feel, and act. Some types of traumatic events are a climbing accident, a near miss, being a victim of crime, loss of a meaningful relationship, or suffering from a chronic illness. So why do we feel this? We are hardwired to have these reactions. Our ancestors were the ones that came away with fight or flight. This causes an increased heart rate, sometimes sweat, sometimes we dump unnecessary weight in order to possibly run from a tiger. This is the origin of how our brain deals with a traumatic event. If short-lived, like in a close call car accident, it subsides and goes away. The stress is severe enough, then prolonged symptoms may continue and the brain has trouble returning back to normal. That's it. This culminates in a normal response to abnormal events. Yeah, there are some after effects of traumatic events. It can involve reliving nightmares, having flashbacks, having difficulty sleeping, feeling detached, psychological and even physiological changes. Early intervention is the key to get back to normal. As I mentioned before, 90% of adults are exposed to some sort of trauma. 74% have symptoms for up to 6 months, depending on the severity of the trauma. Only 1 to 3% develop a clinical diagnosis of PTSD, now known as PTSI, post-traumatic stress syndrome injury. Why do Mazamas offer debriefings? Well, number one, we care. We want to help climbers cope with difficult situations. We want to help you get back into the saddle. We've also found it increases group cohesion and helps people make connections. Many folks who do not talk about what happened will lose touch with those involved because of a negative association. They'll try and distance themselves from those who are involved. We don't want to see that happen. What are the most important takeaways from a debriefing? You are having a normal reaction to an abnormal event. You are not alone, and this too will pass. Random events are hard to deal with for all of us. What is a debrief? It's a peer-facilitated, structured forum to retell the story of what happened. Typically, the whole group involved attends the debrief. Debriefs are confidential. They're not part of our risk management assessment. No notes are taken. In fact, nobody even asks for people's last names. The group reassembles puzzle pieces through a guided discussion. The debrief is not blame. It's not therapy. It's not advice. It's not even an analysis of the accident. And it may not lead people to particular insights. As one Mazama climb team member put it and recorded in the Mazama 2003 annual after rescuing a team of climbers in the Swiss Alps, it was interesting to note how we all remembered the fall differently. We had conflicting memories of the same details, and the Czechs had yet a different account. This is typical of eyewitness accounts. So what exactly happens at the debrief? Ideally, the whole team involved meets as soon as possible after the incident. I want to point out, we are really interested in hearing from you as soon as possible after an event happens. During the debrief, a debriefer will review an agenda and go over an agreement on ground rules. The debriefer will ask 3 questions to take each participant through phases to process the experience. First, we ask, what happened as you observed it? We also ask, what reactions, feelings did you have at the moment and since the incident? And what was the most difficult thing for you? This helps have your brain process both the physical, what happened, the emotional, how did you feel about it, and the cognitive, how to process it. After everyone goes around and answers those 3 questions, we give an explanation of possible reactions and self-care tips tailored towards the group, depending on what people tell us they've been experiencing. We also offer referrals to mental health professionals for additional support if warranted. You're probably asking, nah, I don't need this. Is this really for me? You don't need to be injured to request a debrief. This includes close calls. And anyone can request a debrief. It doesn't need to be the leader of the group. In fact, it doesn't even have to be a Mazama activity. This is a service open to the public. What is minor to you may be major to someone else. Guided talking is a great emotional release and helps you return to normal. Requesting a debrief is a sign of strength and caring for yourself and others. And besides, if a Navy SEAL can do it, so can you. In closing, you can request a debrief by calling the front office or contacting CISM@mazamas.org. One member said the debrief was extremely helpful in processing a highly emotional and devastating event. It was honoring that the Mazamas had this procedure in place for us. Listening to each other's interpretations of the accident was also insightful and educational. I personally often tell my students that the best climbs are the ones where there was a little adversity, like a bear on Mount Adams. Adversity makes for a good story at the pub on Monday. Adversity creates bonds and shared experience. Adversity does not have to involve a critical incident, but if it does, don't forget to tell us your story. Take care, be safe. Thank you for listening. See you in the mountains.